Good afternoon, everyone. Thank you for joining me this Friday afternoon. Today, so my name is Dr. Sarv Varta Khalsa, and I am one of the doctors here at Living Wellness Medical Center. And today I'm going to be talking about Hashimoto's thyroiditis. So I'm pretty excited actually to talk about this topic because I see a lot of patients in my practice that have Hashimoto's. And it's wonderful to be able to help them feel better and to be able to treat their Hashimoto's. So before we jump into the material today, today is kind of an auspicious day for a couple different reasons. Number one, today is the 8th birthday of Living Wellness Medical Center. So that's super exciting. And I have been here almost from the beginning. I joined in April of 2017, the year that my daughter was born. And still here and absolutely loving it. Love to be part of the team with these wonderful doctors here. The other reason why today is auspicious is because it is the summer solstice, which means that it is the longest day of the year and the shortest night of the year. So it's considered kind of a high energy time of year. So it's a great opportunity, a great time to start projects, get things done, do things like webinars. So anyway, hopefully you're all feeling that high energy today. So let's jump right into the materials. So here we go. Okay. So Hashimoto's thyroiditis. Let's go to the next slide here. So what is Hashimoto's thyroiditis? It is an autoimmune disorder that affects the thyroid gland. And so some people really consider it not necessarily a thyroid issue, at least initially in the beginning, but it's actually a dysregulation of your immune system causing an autoimmune response, and your immune system basically attacks your thyroid cells and destroys them. So Hashimoto's thyroiditis is an autoimmune disorder that affects the thyroid gland. It causes the body's immune system to attack and damage the thyroid gland, eventually leading to an underactive thyroid or hypothyroidism. So it is the most common cause of hypothyroidism in developed countries, and it affects females more than males with a ratio of 10-1, so much more common in women. And I have a feeling part of this could be the hormonal aspect of it. Hormones can influence development of Hashimoto's, and the timing of when it might develop is also interesting and related to hormones often. And so I'll talk about that a little bit more. So what causes Hashimoto's thyroiditis? So the exact cause is not known, but it is believed to be a combination of genetic and environmental factors. So, and then from a more of a naturopathic perspective, we often, anytime you have any kind of autoimmune disorder, we always think of gut function, digestion, how are things going there? Because 75% or more of your immune system is in the gut. And so when things are off in that area of your body, that can affect your immune system, including the triggering of an autoimmune disorder like Hashimoto's. So another risk factor is someone that has other autoimmune conditions or diseases. And so if you have one, it kind of leaves you more vulnerable to developing another one, like Hashimoto's, for example. So having things such as rheumatoid arthritis, type 1 diabetes, lupus, having any of these conditions can leave you more vulnerable to developing Hashimoto's thyroiditis. Pregnancy, as I mentioned, there's a strong hormonal element going on here, but there can be changes in immune function during pregnancy that may be a factor in Hashimoto's developing that begins typically after pregnancy, so after giving birth. That's a very common time for this to develop. And it, often it can show up for the first time without any issues before this. So always a good idea, if I have a patient that has given birth and we're checking thyroid, I typically will also check thyroid antibodies just to make sure that they are normal and negative. So what are the symptoms of Hashimoto's thyroiditis? Really, the symptoms, of course, are going to be a lot of your classic hypothyroid symptoms. And so fatigue is definitely the most common one, very common. And then weight gain is another one. I'll have patients that come in and they're feeling tired and all of a sudden they're gaining weight or they can't lose weight or both. And so this is definitely, you always want to check thyroid and check for Hashimoto's as well in cases like this. So, and the reason why weight gain occurs is because your thyroid gland is responsible for regulating your metabolism. And if your metabolism is not functioning well or efficiently, then you're going to have a tendency to lose weight, or it's going to be really difficult to lose weight. Another common symptom is cold intolerance, cold hands and feet, or just feeling really sensitive to cold in general. This is also due to a slower metabolism. Things are just slow. It slows everything down. You can also have hair loss, dry skin and hair, and brittle nails, common. Constipation is another common symptom. Once again, it just slows everything down, including movement of things through your digestive system. Joint pain is a common symptom as well. Depression and other mood issues, but especially depression can be an element of it for some people. And this is a kind of a comprehensive list. Not everybody with Hashimoto's or thyroid disorders, hypothyroidism, have every single symptom here, but these are the most common symptoms. And it kind of varies how these symptoms might express in any one individual person. Problems with memory or concentration can be a factor. Also, puffy face and kind of water retention in general. Sometimes people just experience puffiness of their body in general, definitely water retention. Also, you can have swelling of the thyroid gland, which is right here. Your thyroid gland is right in the front of your neck or your throat here. It's a butterfly-shaped gland. And we call that a goiter when it does become enlarged. And I will say, I would say the majority of my patients that have Hashimoto's thyroiditis do not actually have an enlarged thyroid, but that definitely can happen. I would say it's more common with Graves' disease, which is a different autoimmune condition, which we're not really discussing today, but that also can cause a goiter and is autoimmune. And that is actually hyperthyroidism rather than hypo, which is what we're talking about today. Another thing that can be affected is sexual and reproductive dysfunction. So that can occur. So in women, hypothyroidism can result in a low libido, an inability to ovulate, which therefore creates irregular periods and menses, and sometimes excessive menstrual bleeding. So just menstrual issues can be related to hypothyroidism or Hashimoto's. And men can also have reduced libido, erectile dysfunction, and also a lowered sperm count. So very important to check men as well if they're having any kind of reproductive issues, fertility issues, things like that. And speaking of fertility, it's extremely important to address any thyroid issues that might be occurring when a woman is wanting to get pregnant or going to be trying to get pregnant. We want to make sure everything looks really optimal with your thyroid function, and because that's really important with supporting fertility. So how is Hashimoto's diagnosed? There are a variety of labs that we use to diagnose Hashimoto's, and then also imaging potentially, which I'll talk about in a minute. So the labs that we typically will test are your classic thyroid labs. And so TSH, that's thyroid stimulating hormone. This will typically be high with Hashimoto's and hypothyroidism because that basically indicates that your thyroid is sluggish or you have hypothyroidism. Or sometimes it can be normal. But the way that it works with TSH, so TSH is secreted by your pituitary gland in your brain, and it tells your thyroid gland to produce its hormones, T4 and T3. And if your thyroid gland is not functioning very well and not producing enough of those hormones, it sends the message back to your pituitary gland saying, hey, we're low, we need more stimulation. And it will produce more thyroid stimulating hormone in an attempt to stimulate the thyroid. But if the thyroid is malfunctioning for whatever reason, maybe because of the Hashimoto's or other reasons, it won't respond to that message. And so it keeps sending the message, and then your TSH, and it produces more and more and more TSH. And then eventually your TSH will be high. And that is a classic sign with your labs that you have hypothyroidism. In addition, I definitely always like to also take a look at actual thyroid hormones. So your free T4 and your free T3. Free T4 is the inactive form of thyroid hormone, and that has to be converted into T3, which is the active form of thyroid hormone. So this level can be either low or it can be normal, and especially in the early stages of Hashimoto's. And then we also like to take a look at free T3. And this is the active form of thyroid hormone. This is the form that actually binds to the receptors on the cells in your body and creates all of the benefits that we see, like giving you energy and regulating your metabolism and just helping with all the things we know that are important with thyroid. And it helps to just regulate your body functions. And just a quick note, every single cell in your body has a thyroid receptor, and there's a reason for that. And so that kind of gives you an idea of how important a normal thyroid function is in terms of regulating and supporting your health. So the thyroid piece of things with Hashimoto's specifically, like I mentioned, sometimes it can be normal at first and then eventually can become abnormal. But the way that we officially diagnose Hashimoto's as opposed to just simply hypothyroidism is by testing for those thyroid antibodies. And those indicate that, whether or not you're having this autoimmune reactivity occurring in your body against your thyroid gland. So there are two main antibodies that we test. One is called microsomal TPO antibody. And these antibodies will typically be high. This is the most common antibody to be elevated in people with Hashimoto's. I see it most commonly in my practice. Sometimes, though, it can be the other, sometimes both. So that is the most common, though. And I like to track these thyroid antibodies when I'm treating a person with Hashimoto's thyroiditis. I like to track these antibodies to get an idea of how well we are doing in terms of calming down that autoimmune reactivity in the body. The other one is called thyroglobulin antibodies. And these are antibodies that will also sometimes be elevated in people with Hashimoto's. Definitely less common, I would say, than the microsomal TPO. But sometimes I have patients that have both that are positive. Sometimes it's one or the other. And it doesn't really change how it presents in terms of symptoms, whether one or the other is positive. Kind of all presents the same way. We can also use a thyroid ultrasound as part of our evaluation with Hashimoto's or hypothyroidism in general, but Hashimoto's especially. This allows us to visualize the thyroid gland. And it's actually very common for people that have Hashimoto's thyroiditis to develop little benign nodules, benign meaning non-cancerous nodules in the thyroid gland because of the autoimmune reactivity going on and sort of like this inflammatory response that occurs. And that kind of irritates the tissue, so to speak, and can lead to these little nodules or like little tiny tumors. But they are typically non-cancerous. Of course, it's always important, you know, in evaluating thyroid to make sure, especially if if you can feel nodules or nodules show up with your ultrasound, they'll let you know in the report if it looks concerning or not, and you know, should you do a biopsy to, you know, 100% rule out cancer or not. So, but definitely an important thing to always think about as well, and not, you know, make sure you don't miss that and rule that out. So, but the thyroid gland also can sometimes show enlargement. Sometimes it's just enlargement. Sometimes it's enlarged with nodules. Sometimes just the nodules, and it'll be normal size. So what are the treatments for Hashimoto's? Number one treatment, especially if thyroid labs do come back abnormal, number one treatment is thyroid hormone replacement therapy. And so this actually, by taking thyroid medication in and of itself, that actually helps to decrease the production of antibodies. So that is really the only treatment in the conventional world that they will typically offer in terms of treating this. They don't really address the autoimmune part of things. And I think it's just because they don't have really any treatments for it. Unfortunately, naturopathic medicine has so much to offer. And so I'll talk about those things. So, and in terms of thyroid replacement therapy, there are different options in terms of medications that can be prescribed. There's levothyroxine, which is synthetic T4. That's not my number one choice, but it's okay. Some people prefer that, and you know, that's all right. But a better option very often are the glandular medications that have bioidentical thyroid hormones in them. And so that's definitely a benefit, the fact that they're bioidentical. It also, another benefit is that those medications, which include NP thyroid and Armour thyroid, for example, those medications include both T4 and T3, whereas levothyroxine just has synthetic T4. So sometimes that's a benefit to, you know, be taking a little bit every day of the active thyroid hormone rather than the inactive form. So that's a nice option, and the one that I will typically prescribe for my patients. Another wonderful, fantastic treatment is low-dose naltrexone. I prescribe it all the time in my practice. All, if not definitely most of my patients that have Hashimoto's are on this medication. And I'm going to be talking more about that with a future slide. Selenium. Selenium is a mineral that is also really helpful in the treatment of Hashimoto's, and I'll talk about that more as well. A gluten-free diet, healthy lifestyle choices in general, gut repair, like I mentioned, you know, for the autoimmune part of things, especially if there are known digestive issues. We always want to definitely treat that and address that. In very rare cases, surgery might be a treatment, only if, you know, the thyroid gland has become so enlarged that it's causing problems, you know, problems with swallowing or maybe some pain or discomfort. Surgery could be an option, but it's super, super rare. So I'm going to go through each of those treatments in a little more detail. So thyroid hormone replacement therapy, like I mentioned, it can be either levothyroxine, synthetic T4, or some of the thyroid glandulars. And those are really, really great. And, you know, those are, the dosage, of course, is based primarily on how your labs look, but I also definitely base dosage on how my patients feel. So that's equally, if not more, important than what the labs are showing. Of course, we want to consider those and correlate them, but how somebody is feeling is really, really important in terms of figuring out the most appropriate dosage for them. Low-dose naltrexone. So I just love this treatment really for any autoimmune condition. It's great for any autoimmune conditions, but I love it especially for Hashimoto's, probably definitely the most common autoimmune condition that I see in my practice, though I see others. And so low-dose naltrexone, officially it is a medication technically, but the way that it influences and affects your body is more like a supplement. And so, and because what it does essentially is it kind of helps to reset your immune system, and it helps to decrease that autoimmune tendency that your immune system has sort of accidentally gotten into for whatever reason, whatever triggered that. And it also helps to release endorphins, and endorphins are those chemicals in your body that make you feel really good. And so Hashimoto's can also be really helpful for things like fibromyalgia or pain in general. Sometimes I'll prescribe it specifically just for that. And also fatigue, chronic fatigue syndrome can help with mood issues as well. So many different things. There's even research to show the benefit of low-dose naltrexone in the treatment of cancer. So LDN, I just love it, prescribe it all the time. And it's commonly prescribed by naturopathic physicians. You will not often see that prescription in the conventional world, either because they just don't know about it or whatever reason. But so seeing a naturopathic physician is a great way to have access to prescription for low dose naltrexone. So it helps decrease autoimmunity in the body. You cannot get LDN from a regular pharmacy like CVS or Walgreens. It is prepared through a compounding pharmacy, which allows for individualized dosing, which is always nice. A typical maintenance dose for LDN is 4.5 milligrams per day, that's why we call it low dose naltrexone. That's a very low dose. Just a quick FYI, naltrexone historically in much higher doses, like 50 milligrams, 100 milligrams, has been used in treating people that are addicted to opioids or alcohol, and they're trying to get off of those things, and it helps them get off those things. But that's not what we're talking about here. Those doses are much, much higher. So LDN is like 4.5 milligrams a day. But I often recommend a slow titration upward over a period of 3 to 4 weeks to avoid any possible side effects, though it is generally very well tolerated. And so I might start with 1.5 milligrams a day for a week or two, depending on the patient. If I have somebody that's really sensitive, I'll go a little slower with the titration. But otherwise, I'll do 1.5 milligrams for a week, and then boost up to 3 milligrams for a week, and then boost up to 4.5 milligrams for a week. And then if you're doing well with that, that will be kind of your maintenance dose continuing forward. So, and as I mentioned, LDN is generally very well tolerated, and side effects are uncommon. The most common is vivid dreams or nightmares, or interfering with sleep in general. However, this can be easily remedied by just switching to taking it in the morning. So that just eliminates that side effect. And, sometimes I'll have a patient come in that also has issues with sleep already, and they're a little nervous to take it before bed. So we'll just right off the bat, just start taking it in the morning, which is totally fine to take it in the morning versus taking it at night. I think when, back in the day, it was recommended at night, but I think, more recent research suggests that it doesn't really matter whether it's morning or night dosing. So that is low-dose naltrexone. Selenium. So selenium is an important mineral that helps to decrease thyroid antibodies, and it also is an antioxidant. That's one of the reasons why it helps with thyroid issues, and especially Hashimoto's, is because your thyroid gland actually is very sensitive to exposure to toxins, and it does have sort of a tendency to absorb things like toxins. Antioxidants kind of help to protect against, toxic exposure and cellular damage due to that toxic exposure. So antioxidants are really generally helpful for thyroid conditions in general. So selenium is an antioxidant. It helps protect against that oxidative damage. It also has a dual benefit of helping in the conversion of T4 to T3, so the inactive to the active form of thyroid hormone. Because some people are better converters than others. Some bodies do a great job of that and others do not. And if your T4 looks okay, but your T3 is on the low end or low, you could not feel very good and feel tired. So I usually recommend about 200 micrograms a day of selenium. That's easy to just take a little tiny capsule every day. If you want to do food-based, you can eat Brazil nuts. They are high in selenium. 3 or 4 nuts a day equals about 200 micrograms. So that's what you want to shoot for. Sometimes I'll use combination products. Like there's one I recommend a lot called Thyroid Support Complex that has lots of wonderful things in it to help support thyroid function, but it also has 200 micrograms of selenium as part of that formula. A gluten-free diet. I know this can be tough and tricky for some people, but I always do recommend a gluten-free diet in my patients that have Hashimoto's thyroiditis. And research has shown that eating gluten can actually worsen Hashimoto's and increase production of those antibodies. And it's thought that there is some sort of cross-reactivity between gluten and your thyroid in terms of, your autoimmune sort of response to those things. And so it can actually increase or worsen Hashimoto's. And so a gluten-free diet definitely is recommended if you can manage that. Healthy lifestyle choices, of course, is the foundation of any condition, any reason why your body is not functioning as it should. And so eating a plant-based diet, and by plant-based, I don't necessarily mean purely vegan or vegetarian. I mean, that's fine if that's a choice that you make, but just including a lot of plant-based foods in your diet, lots of fruits and vegetables, things like that. So plant-based diet with the addition of, good, clean animal protein if you want to, plenty of good fats and foods that contain antioxidants to help protect your thyroid gland. Just think brightly colored fruits and vegetables are just chock full of antioxidants. Those are wonderful. Also, regular exercise is really important in supporting your thyroid gland. And of course, your just overall health is always going to be better when you exercise regularly. Surgery, like I mentioned, super rarely needed, but is there as an option if necessary. So, in conclusion, Hashimoto's thyroiditis is actually a fairly common condition. And I really think that the incidence of Hashimoto's has increased a lot over the years. And I would suspect part of that is just toxicity, the toxic world that we live in, all the plastics and herbicides, pesticides, all that stuff. Eating organic is helpful. Trying to limit your exposure to those things, plastics especially, is going to be helpful. And so it is really fairly common. It can be easily diagnosed with the things that I mentioned earlier, and it can be treated effectively. That's the really good news, is that we can treat it both with conventional as well as natural therapies and help you to feel better and regain your health. And sometimes we can actually revert these antibodies, these Hashimoto's antibodies, to negative, and either it's in remission or it sometimes is just resolved, which is wonderful. So I've definitely seen this with some of my patients, which is great. So if you're someone either has Hashimoto's or you suspect that you might do, you definitely want to schedule an appointment with your naturopathic doctor. If you don't have one, you can come see us here at Living Wellness Medical Center. And we always do a thorough evaluation and, of course, start that healing process. So here's my information here at Living Wellness Medical Center. I work with 3 other wonderful female physicians, naturopathic doctors. We all do a 15-minute, sort of like a free 15-minute meet and greet phone consultation. If you're considering scheduling an appointment and you just want to make sure it's a good fit, you can give us a call, schedule one of those. And here at Living Wellness, we kind of rotate through who does, each of the docs does a webinar each week. We kind of switch off who does a webinar. This month was my opportunity, yay. So, but next month, tune in for another wonderful webinar. By the way, this is recorded, and so you can find this. I think it takes a couple of weeks, but it will be on our YouTube channel, and all of our webinars are posted on our website. So you can go to that and rewatch this presentation or share it with a friend or somebody that you think could benefit from watching it. So anyway, if anybody has any questions, I would be happy to answer them. I'm going to turn it over to questions. So let's see. And there are some already. So yes. Okay. Judy asked, what is the difference between hypothyroidism and Hashimoto's? Yes. Thank you for that question. Maybe it was answered during the presentation, but basically hypothyroidism is just when you have a slow or sluggish thyroid. Hashimoto's thyroiditis is when you have antibodies to your thyroid that is causing the hypothyroidism. And so sometimes you can have hypothyroidism without the autoimmunity. And by the way, if I have a new patient that comes in, I will often, almost always check antibodies right off the bat, whether they are suspecting thyroid issues or not. I like to rule it out. Just make sure, check it once, make sure that everything looks good there, is negative, because you can have positive thyroid antibodies for 10 years, for years before it actually causes your thyroid labs to become abnormal. And then once the thyroid labs become abnormal, that's just a sign that so much cell destruction has already occurred that you're most likely going to need to rely on medication for lifelong. So we want to stop it in its tracks as soon as we detect it and work on that, decreasing those auto antibodies, and so that it's not destroying your thyroid function, your thyroid gland. So hopefully that answers your question. And then Megan's asking, does one remain on LDN lifelong? That's an excellent question. You definitely can. It's so well tolerated and so safe that, I think that's probably a good idea. Sometimes, like let's say I have a patient and we've been treating and they've been taking LDN, let's say it's a number of years, their antibodies have reverted to normal. We might do a little experiment and maybe go off the LDN and, of course, continue to closely monitor thyroid labs, antibody labs, just to be 100% sure everything looks good. And then maybe they can get off of it and not have to stay on it. So, yes, there is the possibility of getting off of LDN, but it really depends on the situation. And but I would say more typically it's kind of a longer term treatment rather than a short term treatment. Kelly is asking, so she said, I just started on levothyroxine today. Do you ever prescribe both levothyroxine and LDN at the same time? Absolutely. I will commonly do that, actually. And then levothyroxine is fine. If I have a patient that comes in that's on levothyroxine and they feel good, their labs look good, I'm fine with leaving them on that. Sometimes, though, we will switch to a glandular, either the NP thyroid, which is what I commonly prescribe, or Armour thyroid, if they want to do that. And especially if maybe they're not feeling as good as they want to with the levothyroxine, or if their labs just are not, don't seem to be easily balanced and regulated, then we might do a switch there. But yes, I often do a combination of thyroid medication of some sort and low dose naltrexone. So yes, absolutely. All right. Are there any other questions? I'm on Tyrosint. should I start LDN? That really depends. So Tyrosint is a form, it's a thyroid medication. Whether you should start LDN or not, it depends on whether you have positive antibodies or not. And so I'm not sure if you're currently a patient here or somewhere else, but if you are a patient here, you should ask your doctor or ask your doctor in general. Have your thyroid antibodies been tested? Were they positive? And if so, then yeah, I mean, if you were my patient, yes, I would say yes, you should start on LDN. It's a wonderful treatment for Hashimoto's. Okay. Looks like there are not any other questions. Once again, thank you all so much for joining me today. It's been a real pleasure. And like I said, tune in next month for our next webinar. And I hope you enjoy the rest of your Friday and enjoy your weekend too. All right. Take care. Bye-bye.